Hi, my name's Larry, and my channel is called Living with Stage 4 Metastatic Prostate Cancer, and we're here today at the Neurosurgery Department at Geisinger in Danville, Pennsylvania. We're waiting for Derek, the physician's assistant, to show up.
Hello.
Hello, Derek.
How are you guys doing?
Good.
Good.
This is my sister Pam. She's my private nurse from
How are you?
Tennessee.
Hi, good.
She was a nurse for about 40 years before she retired. So,
Where'd you work?
All over.
this is Derek, the physician's assistant for Dr. Connie Condola.
Nice to meet
Were
you.
you there at the surgery? My
I
surgery?
was not in
Okay.
your surgery. No, I actually think I was off that day.
Do you
so
have the results of my biopsy?
I do. I do. So all good stuff. So it was a World Health Organization, so we call it WHO. Sometimes when I say WHO, they're like, who? It's kind of like that old film, like Who's on First, you know.
Alan Costello.
Yeah. So it was a WHO grade 1, which is the most common form of meningioma. It's actually a benign meningioma. So WHO grade 1 meningioma with a low proliferation index. I think it was a proliferation index of 3% or whatever. It's MID.
That's what we want to hear.
So all good stuff. I read the notes. It sounds like everything went completely successful. And then we usually just kind of do subsequent scans later on and make sure.
I actually feel a little better.
I was just going to ask you that.
Yeah, I it's not like night and day, but I'd say I'm like 15-20% better. I probably walk as good as I did 6 months before the surgery.
Okay.
Because I deteriorated that last year
Yes.
considerably.
Which makes total
So
sense.
I'm back about 6 months before the surgery.
Okay. Here's the even better part. That's going to continue to improve.
Oh, great.
Yeah. So you're about 2 weeks out from that surgery.
I don't know if I can take all this good news.
I know. It
Not
feels
used to
weird.
it.
Well, that's the thing about life, right? Like you get
Yeah.
going, you're like, okay,
Yeah.
there's so much adversity. It's like, okay, wait,
Right.
where's the good news?
Right.
So, and that's the cool part about surgery. Are there surgeries that happen that there's not good news? Yeah, absolutely. That happens all the time. You know, those are typically for different issues, of course. But for yours, what's nice about this particular niche of spine surgery is you have a benign tumor that was pressing on a whole bunch of nerves. You simply go in, you remove the offending object, the nerves heal. Now, the only caveat to that is you can't necessarily tell, okay, like, can you guarantee someone 100% of improvement? No, that's you know, when you deal with the nerves, that's the problem with the nerves. It's like you can never guarantee that.
Right.
Does it happen? Yes, it happens frequently. There's a lot of people that they come back 6 months later and like, well, I have full function. I feel great. There's some people that come back and are like, I'm about 75 to 80%, which is still incredible.
Oh yeah, that is.
You know,
I'd settle for that.
yeah. So, you know, this takes all the way up, 3 to 6 months at least, sometimes even up to a year. But if you already notice 20 to 30%,
Yeah.
already a
I'm
quarter
probably-
of the way there after 2 weeks,
I'm probably 15-20.
amazing. That's already a huge benefit, and you're going to continue to see improvement. And when you think of it from an anatomical perspective, the reason for that is because where the lesion was, it's in the main part of the cord. Okay, so if it was just an exiting nerve root, like you see here on the
Yeah, on the
spine,
side. Yeah.
if it's on the side, then you would only get kind of symptoms in that dermatome distribution. Sometimes you see this with people with like disc issues. They'll come in and they might have like a drop foot. That's different. The problem when you have a tumor or even a disc can do that too if it's in the thoracic spine. But especially in your case, if you have a tumor literally compressing the whole cord, everything distally to that offending stenosis is going to be affected. So everything distal to that is going to take time to improve.
Sounds great.
So you're in a great spot right now.
I'd be even in a better spot if I could get these staples out of my
I was
back.
just going to say, do you want to keep them or do you want us to
No, I want them gone. You can keep them.
I love doing that to people. I have some people who are like, wait, how long do I need these? I was like, no, we'll take them out
You
today.
can keep them, yeah. All right. I'll get ready.
Yeah, he couldn't wait to get here today to get the staples out.
Oh yeah, I'm excited. I want these gone, baby.
That's my favorite little
Yeah.
thing to do.
Little incision humor.
It is my favorite. There we go. Yeah, should where you really see the incision line, like that's how great you heal.
Mm-hmm.
Phenomenal.
Yeah, I was impressed with what it looked like.
Phenomenal.
In home care, I've seen some bad.
I was just gonna say,
incisions.
being a nurse, you've seen some stuff. Do you still practice at all, or do you retired?
No, I retired.
I don't blame you at all. Like a foamed kind of alcohol.
Mm-hmm.
It's, of course, it's on the wall as a hand sanitizer, but what we found is, yes, you can remove the staples without doing anything, but something that we found even better is that when you kind of sanitize it,
Mm-hmm.
it also obviously prevents the risk of infection because there are holes
Mm-hmm.
that the staples leave, but it also debrides some of that dead tissue.
Yeah.
So it works really well. Yeah, this looks beautiful. And correct me if I'm wrong, I think I saw on your chart, you had, what type of cancer was it?
Prostate.
So you had,
metastasized into my lung, my right lung.
Yeah.
so you've had your fair share of tumors.
Yeah.
He gets a lot of lipomas too. Da, 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 da.
That's it, my friend.
Is that it?
Beautiful.
That
Shirt
is
down?
it.
Are we,
It's perfect.
okay, put my shirt down?
Yeah.
No, you're golden.
Good.
Essentially,
I'm going to
I was just gonna say, you're going to
Therapy,
we
sure.
got perfect.
I have it today.
Perfect.
Okay. It's the second, well, I was evaluated and I had one session, this is my second session.
Okay.
But they understand, they got all the info, so.
So intraoperatively, the only thing, I shouldn't say the only thing, it makes it sound diminutive, but the thing that we did was essentially a laminectomy on two of those levels to access where the cord is.
Right.
So there's no structural instability.
Mm-hmm.
Obviously there's no hardware either.
Right.
So there's really no limitations to what you can do. Now, that's not to say if you move really fast or move a certain way that you could kind of aggravate some of the muscles and soft tissue. That's a reality.
Right.
But you're not really going to do anything to cause any damage.
Okay.
That's
good.
2 weeks out, any type of, obviously we have to cut down and get to that area. So one of the thoughts, especially with you being in healthcare, is like, okay, what's the risk of like bleeding or inflammation or anything like that? You're pretty much out of that window.
Good.
So any type of movement is encouraged. Walking, elliptical, bicycle, all of that's fine. The only thing from a spine perspective is like with bending, lifting, twisting, is just kind of be mindful over the next 4 to 6 weeks.
Right.
It's not that you can't do it. It's that you might notice maybe like a little twinge, like you kind of do something and you'll notice
Don't
like,
do
oh,
that.
wait,
Yeah.
what was that?
Right.
Let your mind relax and know that it's not anything that's bad that's going to happen.
Okay.
It's mainly just, all of the soft tissue kind of healing. Because we have to, dissect all of the thoracolumbar musculature, all of the rector spinae muscles, kind of separate everything, and then also, of course, chew off some of that bone to get down to the spinal cord.
About how wide of a slot
Oh, yeah, sure. This is actually pretty anatomically correct.
is there? I mean, is it?
I forget without opening the trigger.
What do you call these things again? These.
So these here are the spinous processes.
Okay.
Okay. So we go 5, 4, 3, 2, 1, 12, 11, 10, 9, 8.
Which
So-
these two.
These two right here. So this is you laying on your back,
Mhm.
and someone already took the liberty of drawing on them.
Okay.
So it really is just that. It's we don't go into the joint, because if we go over here too far, you could see that you get into the joint itself.
Right.
You don't want that.
Right.
As long as you stay medial, you can actually take we take a bone scalpel, and it literally is just that. We carve here, because I think yours was 2 levels, right? If I'm not mistaken.
Yes.
So
8 and
here,
9,
here, and here. So 4 incisions,
and then take those out.
and then this just comes off.
Okay.
Once that's lifted off, and I'll kind of distract this a little bit so you can see,
Mhm.
we get down to the dura.
Yep.
Once we get down to the dura, then we have to make an incision in the dura,
Mhm.
kind of peel it to the left, peel it to the right,
Right.
and then we can get where the cord actually is.
Right.
And then that's where the fun stuff starts, because
was mine on the dura or was it actually on this cord, the cord itself? Or was it?
yours was intradural. I don't know the extent without asking Dr. Konakondola.
Best of all things.
Yes.
If I was gonna have one, that's the best one I could have.
Yes, absolutely,
Okay.
absolutely,
All right, great. I'm pretty stoked. Yeah.
absolutely. Yeah, we geek out about this stuff a lot.
Right.
And golfing? He
Oh, I
golfs.
forgot about
Yeah.
that.
So you would be golfing right now, would
It's February, March, April. Around here,
May.
I mean, I don't go to Florida or anything, so it'd be May.
Perfectly
anyway.
fine.
Yeah.
Perfectly fine. Yep.
Okay, great.
Yeah, and Dr. Konakondola, so I don't think he would mind me saying this, but and calling by his first name is I think Sanjay would approve.
Mhm.
He's a golfer also.
Good.
He loves
Yeah,
golfing.
Good.
so,
Good.
so if I told him, I'd be like, hey, do you care if he goes back golfing? Heck yeah, absolutely.
All right. Good.
It's a
Well,
pleasure seeing you guys.
thank you,
If you need
Tony.
absolutely anything,
Okay.
give me a holler. You can either my guy singer me, send me a message there if you want to call, whatever. I can talk to you on the phone, whatever you need.
Am I going to get a report on that biopsy?
It
Is that
should
gonna-
actually be in your My Guy
Okay.
Singer. Yep.
Appointment right now?
Yeah, just at checkout.
Okay.
Yep, just at checkout. And then we'll see you in about 3 months. I'll try to get you back with Dr. K so that way you see both of us that day.
Right.
I always like to keep him updated about the 3-month mark.
Right.
And
Okay.
then,
Great.
If you need anything, like I said, give me a holler.
It's a beautiful day outside too, by
It
the way.
looks awesome. I'm gonna take a walk a little bit later
It
on.
is. Yeah. Great. Well, thanks, Gary.
You're very welcome, my
All
friend.
right. Thank you.
Yep, give me a holler if you need anything.